Hello, everyone. My name is Dr. Michael Soileau with Texas Movement Disorder Specialist just north of Austin, Texas. And I'm a movement disorder specialist who has a lot of familiarity with treating Parkinson's patients. And I'm excited to talk to you a little bit about one of the most common questions that I get asked by both healthcare providers and patients, and that is, when do I need to consider another treatment option of levodopa? So I'd like to talk to you a little bit about Vyalev. And Vyalev is a subcutaneous levodopa that's delivered underneath the skin. And the reason that it's so important and such a neat thing to talk about today is because it's the first and only subcutaneous levodopa that's been approved by the FDA. And it is not only a daytime treatment, but it's a 24-hour treatment. So a little bit about the pivotal trial. I was a clinical trial site for this particular trial. And this trial was a double-blind, placebo-controlled trial that actually compared optimized oral carbidopa-levodopa with Vyalev. And the patients that were on active Vyalev pump were on placebo pills, and the patients that were on a sham placebo pump were on oral carbidopa-levodopa pills. And at the end of that 12-week study, when we compared the off time as well as the on time, we found that even in optimized oral carbidopa-levodopa patients, as good as we could possibly get them, that Vyalev was able to do almost 2 additional hours of improved off time and improved on time without troublesome dyskinesia. And the reason why that's so important is turns out how we deliver this medicine actually really matters. And so the fact that we're taking the GI tract out of the equation and we're putting it underneath the skin and allowing it to be delivered in a constant fashion throughout the 24 hours a day is very important with improving someone's motor function. So that's the first thing I would like to share, is how we deliver it actually matters. We have some patients that have trouble with eating protein and how that interacts with their levodopa and makes it not kick in as quickly. And so they feel that as manifested by off time. And so this takes the GI tract out of the equation and allows them to be able to eat anytime and every time they want to without having to worry about whether or not they would sacrifice their motor ability. So that's one thing. I think the other thing that's important about this particular therapy is that, as I said, it's delivered 24 hours a day. And so many of our patients have what's called nighttime symptoms or early morning akinesia, where they'll wake up in the morning and just not be able to move very well. They may have wearing off dystonia in the middle of the night where they have cramping and curling of their hands or feet, and that causes disruptive sleep. So the fact that we're able to give them a levodopa product where they can have a continuous flow of that even throughout the evening, even throughout sleep, so that their morning is better as well, is something that even in our trials, in my personal experience, I was able to witness firsthand with many of our patients. So that's the other thing I think is very important. So lastly, oftentimes when our patients are on oral carbidopa-levodopa regimens, they're used to these big peaks and valleys, and that creates chaos really when it comes to trying to keep them in the on state. As I say, keep their gas tank full, not overflowing where they're having dyskinesia and moving and wiggling around, but also not under treated as well. So they're used to these big ups and downs. So when we have a hard time achieving that with oral regimens, this is a perfect consideration, in my opinion, because again, it delivers it continuously. And so that has allowed patients to also be dialed in more precisely. So every 0.01 milliliters of this particular product is equivalent to about 1.7 milligrams of levodopa. So that's been helpful too for the patients that are quite sensitive to the medicine. We can really dial it in. So we're grateful to have yet another treatment option for Parkinson's disease, and grateful to have a new type of treatment option where this is delivered underneath the skin continuously. And so just thought you would enjoy a little bit about this particular therapy.